I guess probably, honestly, one of my most memorable moments was attending the very first one and actually meeting Dr. Leon. That was an incredible, actually, milestone in my life, just to meet this doctor, and now having worked with him for over 20 years, or just about 20 years, it's really incredible. There have been many other great moments, especially those that involved live cases that were particularly difficult to achieve, and the physicians, through their skills in front of a live worldwide audience, have demonstrated that they could save these patients' lives and let them be discharged from the hospital quickly and back to their normal lives. So I think that's really the essence of what goes on at TCT.
All I can say is it's a miracle the way they do this. It's very quick. It's very satisfactory medically from what I have observed, and it's nice to be able to get up and get out.
Well, Jack, you're a very kind gentleman to allow us to you've got about 2,500 people in the audience who are watching you right now, and you look great. You look like you haven't had a procedure today.
Well, the 2,500 people are more frightening than this operation or whatever procedure.
I think there are many moments that stand out in my mind as being special. It's a lot of it evolving from live case demonstrations. I remember distinctly the year that we first began doing transradial angioplasty at TCT. It was an extraordinary observation to see a few groups, particularly the group at Toulouse with Jean Fagedet and Jean Marceau.
We tried for this first patient a transradial approach and tried to do the angioplasty on the right coronary artery with a 3.5 balloon, implant the plasma shot stent through the 6 French guiding catheter.
Demonstrating techniques in complex patients that we had never seen before had a transforming impact on the way people thought about that procedure. Watching Antonio Colombo do some never-before-done procedures really began to give us the courage to think beyond the more narrow confines of the operational limits of where we can take angioplasty.
I tell you one thing honestly, it's the first time I do the things like these.
Don't say so.
At the same time, there are special moments and things that are surprises that occur during the meeting. I recall vividly when Antonio Colombo transmitted a very interesting case of directional atherectomy, and the patient happened to be an opera singer, so as part of the case, he actually serenaded the audience of TCT. It was an unusual, special moment at TCT that I think most people will remember who were there.
Mr. Mario Da Vinci will start with a song while we start our case, and we have technician Amato with on a guitar on the right that will play while we do the case. Okay, let's start. You can start a little bit and you will see the lesion that we treat is a proximal LED that we plan to do atherectomy, the nostrial LED that you see on the screen.
I don't think anything can equal Antonio's singing atherectomy as a singular event. First of all, I'd never laughed so hard at I think anything, but at the same time admired the brilliance of the point he was making with this, the combination of music, science, and humor.
He's a singer.
Sta in frente a te.
Bravo. Molto bene, very nice. Very nice.
In the early days of TCT, There was a little bit more of a social environment, a gala event that was particularly interesting. We had John Mellencamp actually do a mini concert at TCT. He was a former angioplasty patient and was very interested in giving back. It was a raucous event that was very exciting. Certainly when TCT had its great growth spurts, we started in hotel venues. We started at the Omni-Sherm Hotel. We went to the Sheraton Hotel. We spent some time at the Grand Hyatt Hotel in Washington. The move to the first Washington Convention Center was certainly a recognition that we've come alive, that we've made it, that we've gotten to the point where we need a convention center to actually express the multiple simultaneous activities.
I remember when we first moved TCT from the Grand Hyatt Hotel to one tiny corner of the old Washington Convention Center, and we walked into the main arena, which I believe sat 1,500 people at that time, and we looked around and we thought, boy, now we've reached the big time. Well, compared to what TCT is now, that was a tiny meeting. So I think maybe that was the first time that I personally realized how big TCT had become and how big it could grow in the future.
The first, I think, initiative was to make a large second room, which we called the coronary theater. The concept was always back then that the main arena would be for primarily investigational devices and new approaches that are off-label approaches that are not yet FDA approved, where in the coronary theater would be more for the average everyday cases, but being done by the superb leading operators in the world. And you had people that went to one venue or the other based on what their main interest was. And that led to, I think, an increase in attendance by probably 1,500 to 2,000 people within a couple of years. It then became very clear that the field of interventional cardiology was expanding. So we created the third venue, which was the, back then called the peripheral theater, now the endovascular theater. And then shortly thereafter, it became very clear that structural heart disease was going to be the next main arena. And then, of course, interventional valve therapies, which we believe right now is going to be the next big thing, and is certainly a very fertile area for investigation. So we created the fourth venue, which was the structural heart disease theater.
And then when we transitioned to the new convention center, that was another major growth opportunity that was very exciting to us. Similarly, we look forward to transitioning TCT into a bicoastal event and going to San Francisco next year. I think that will be another important moment for us.
I think the certain moments that I remember that were really breakthrough and very special were watching, the very first of each technology, the first percutaneous valve treatment live at TCT. Those are all extremely memorable. To know that we are really going on to the next level each time. The first time the late-breaking trials of drug-eluting stents were presented at TCT, and knowing that, wow, there's truly a new breakthrough in interventional cardiology. Those are extremely exciting.
I have so many phenomenal memories of TCT from the time I was first attended the course as an audience member to the time I was first invited to be a faculty member to the time I first became the co-director of the course with Marty about 10 years ago. But individual events that stick out in my mind really relate to important growth areas of the meeting more than any one signature event. So, for example, the late-breaking trials, I believe, have grown in tremendous importance and significance, and I'm very proud of the fact that we've introduced some of the most important studies ever performed in interventional cardiology at the meeting, from Sirius to Taxis 4 to Horizons to this year's Syntax.
This is something that Greg Stone came up with last year. He said we should be doing late-breaking clinical trials at TCT. And anybody who knows Greg, he's a relentless kind of guy.
As we began to do evidence-based medicine at TCT, the first presentation of major clinical trials, things like the Sirius trial, Taxis 4, were profoundly important events because it elevated TCT to the status of the AHA or the ACC meetings and presenting unique data for the first time that would be clearly impactful in the way that we take care of patients and the way we view new devices. That was a very important moment for us.
I'm very proud of the fact, as much as anything, I think, of our emphasis on evidence-based medicine, and the fact that I do truly believe that interventional cardiology has been a trailblazer in leading the rigor of clinical trials to prove the utility of whether it's devices or drugs or approaches.
So yes, TCT has many, many great memories for me on every front. And I think everyone who's been privileged to be part of TCT, especially on the faculty, for me, my first main arena presentation was extremely special to me because my parents were in the audience, and it was something very, very special, and I was very, very glad to have that opportunity, especially since I've lost my mother since, and so it was a very emotional and great experience for me. It was on in-stent restenosis, and I remember it very well when Marty gave this incredible introduction for me, and as gracious as he has always been, and it was my first main arena lecture, and I got up to the podium, but just before he came off the podium, and he said, "Make sure you don't go over it by 1 second." And I was like, "Okay, Marty, I promise." And I got up because he gave me this great introduction, but he was sure to let me know not to go over, and I didn't. So it was a great memory for me, personally, as someone who's been on the podium at TCT.
My best memory is every single time somebody comes up to me and thanks me and all of CRF for all the hard work that goes into TCT, for putting on TCT every year. Nothing replaces that, because it means that we are appreciated, and individuals who come to TCT benefit from the meeting and recognize how much effort goes into it.
I think my greatest sense of accomplishment with TCT was to take an idea whose time had come to try to evolve and transform education within interventional cardiology, and to help grow that with the help of many people to another level that has become embedded within a subspecialty that now cares for millions of patients on an annual basis. So to be part of that process, to be a shepherd or sherpa of the evolution of that process, which now has an impact on millions of people, is my greatest sense of pride and accomplishment.